Update?
It was updated yesterday.
Yeah, this Zoom looks so different.
Different, yes.
Does yours look different too?
Yep.
Need upgrades.
I have to like refamiliarize myself.
Just to confuse us.
Yeah,
Mhm.
just to confuse us. Well,
Is it recording?
um, it looks like it's recording. So we'll go ahead and get started. We're going to kick off with Scott from Fusion Academy. He's going to give us a spiel about the organization he works for, and then we'll make our rounds and get started with the discussion.
Awesome. Thanks. So like Alexandra said, I'm Scott Fuller. I'm the Director of Admissions here at Fusion Academy in the Houston Galleria. Fusion is a 6th through 12th grade private school, and everything that we do is one-to-one, one student to one teacher. So we're able to personalize everything to the student's learning style, any learning differences that they may have, as well as their interests. Yesterday we had someone dissecting a shark instead of a frog like I did in high school. And so that was super cool. But yeah, we do rolling enrollment, so always taking on new students and getting them where they need to go. So
And your
I'll throw
location?
my information in the chat, but we have locations all across the nation, but 3 in Houston: Sugarland, Galleria, and Woodlands.
All right. Pam, would you go next, please?
All righty. Most of you probably know me. I'm Pam Esser. I'm Executive Director of ADA Southern Region, and we've been around since 1987. So we still offer support groups. Right now they're free and virtual. If somebody wants to do it in person, we're certainly happy to get them started that route. And then we do educational events throughout the year. Our next one's going to be one on navigating divorce in a neurodiverse family. We had to postpone it because of Beryl, but it's going to be now on August 29th. So welcome to everybody. This is a really cool thing that we do.
All right, Julie, you're up.
Hi, everybody. My name is Julie Pomerantz. So I'm with the Hub Houston. Hub stands for Heard, Understood, Believed in. And we have programs in a school wherein we work with adolescents and young adult, all the way up through young adults who have neurological differences. We have several different campuses. We do have a school for approximately ages 13 to 18, a very small school. Besides the neurodiverse population, we do have those that might be with us due to mental health issues such as anxiety or depression. But I would say most of our students and members are going to be on the autism spectrum. We also have young adult programs. We have our Life 101 program that serves ages 18 and over. It's an employability program where we help them find employment and just help them through that young adulthood as they transition into that age bracket. We also have Club Hub, which meets 3 nights a week and 1 weekend day a month. Again, that's 18 and over. It's strictly a social club, and they can build friendships. We see many of them meeting each other and carrying on to socialize with each other even outside of the program. So they just love that program. And then we also have Aspire Accessories, which is on another campus, and that's 18 and over. And we actually hire those young adults to work at Aspire. They make beautiful items that are sold online and in markets. And most of our programs are all in the northwest part of Houston, but we have people attending from all over the place. Thank you all so much.
Thanks, Julie. Hi, everyone. I'm Alexandra Roark. I'm a therapist and assistant director here at Houston Neuroscience Brain Center, and I'm here with our director, Dr. Ron Swatsina. And at the Brain Center, we look for neurological causes by through our EEGs and QEEG brain mapping. And then based off of the EEG reports, we create an individualized treatment plan that may include neurofeedback training, which is a form of brain training, photobiomodulation, talk therapy, or EMDR therapy. We also work with professionals and organizations across Houston to ensure that our clients are receiving well-rounded treatment. and referring out when we need to. We know it's really important to look for the root cause of the issue. And I'm really excited for our topic today. Today, we're going to be discussing integrative pediatric neurology, improving diagnostic accuracy. And our guest speaker today is Dr. Melissa Jones. We are so happy to have her. We've worked with her throughout your whole career almost.
About 2008.
Since 2008. And it's been incredible working with her. We have a lot of interesting cases that we've shared together. And so to introduce her, I'm going to go over her bio. Dr. Melissa Jones was born and raised in Houston, Texas, and graduated from Stratford High School. After earning a BS from Northwestern University in Chicago, she returned to Houston to attend Baylor College of Medicine for medical school, pediatrics residency, and pediatric neurology residency. Being trained at both Texas Children's Hospital as well as in the Harris County Hospital District, Dr. Jones is well prepared for both the simple and more complex neurological disorders. She graduated from pediatric neurology training in 2011 and has been practicing in Houston and the surrounding areas ever since. In January 2023, she completed the Functional and Integrative Psychiatry Fellowship and turned her career path towards a more investigative and functional approach focusing on PANDAS, and neuro-inflammatory conditions. In addition, Dr. Jones treats a broad range of neurological conditions, including headache, seizures, epilepsy, autism, ADHD, tics, developmental delay, and concussion. And so welcome, Dr. Jones. Thanks for attending with us today, speaking for us.
Thank you for having me.
Yeah.
So we're going to do this a little bit different today. Dr. Jones loves to talk off the cuff. And so she just says, send me some questions. And so I sent her the questions last night. So you guys shall enjoy this. And would you go ahead and ask the questions?
Yeah, we have some preset questions that we're going to ask, and it's going to go over some interesting stuff. So if you have any questions in the audience, we're going to make sure we have ample time at the end to address your questions. Feel free to put them in the chat. We can address those, or you can just speak up at the end whenever we open it up to everyone. But Dr. Jones, for the first question, can you please explain the difference between pediatric neurology and integrative pediatric neurology?
Yes, definitely. Well, you said that you guys work on getting to the root of the problem, and that's pretty much what integrative and functional neurology does as well. So your typical pediatric neurologist is going to see ADHD, seizures, migraines, and such, and it's pretty much a symptom-based medication approach. So you have seizures, here's your seizure medicine. We hopefully stop the seizures. And that's how I was trained and what I was doing for many years of my career until I realized there might be a root cause to some of this stuff. So that's where more of an integrative and functional approach. And so I'm a pediatric neurologist. So of course, most of my patients are tailored more to neurology, although I joke all the time, I double as a GI doctor because the gut and the brain are the same, they're connected. And so yeah, I really do a lot more testing. I think as you think more of a functional approach, you're going to have more testing, more getting to the root cause and treating that versus saying, okay, what's your symptom? Headache? Okay, here's your Tylenol.
Okay. Come back to this one. Can you give an example of a case in which digging deeper provided answers that otherwise would have been lost?
I know, I was thinking about this. I have so many. So how much time do we have? 6 hours? No. So I was like, well, we have some easy, pretty kind of straightforward cases, or we have more complex ones. And I thought, well, let me pick one of my harder cases. And, you know, for any parents that might be listening, I think that this really gives an example of kind of how complicated it can get, but then also the light at the end of the tunnel. I think everybody wants their kids to get better really fast. And so they're like, okay, give me the problem and let's fix it. But if we get a really complicated case with a lot of roots to the problem, you know, that can take time, like a year, maybe 2 years. And so if we kind of have that vision, like, hey, we're going to attack this, we're going to get rid of every problem one at a time. You know, I think that you have to have that mindset kind of going in, because it can be very overwhelming and very kind of frustrating when you're like, why is my kid so sick? But yeah, so, you know, kind of one of the cases I wanted to share, I had a 6-year-old, kind of kindergarten age, who was neurotypical, everything's going fine, a little hyper, but otherwise things were things were rocking and rolling. And then he kind of changed over a summer. He just sort of went downhill. He became unbelievably, quote, ADHD. He was OCD. He was anxious. He really couldn't function. He couldn't function in school. Teachers were like ready to kick him out. And it was a big change. And so parents just started seeking. And who do they get to? First, they get to a psychiatrist who gives him anti-anxiety medicine and an ADHD medicine. That didn't work. So they start to just seek out, like, what's wrong? What happened? What's wrong? And so they made it to me. And I said, okay, here we go. This is what I do. I always start with a big panel of blood work. I like to just kind of see where's vitamins, where's minerals, where's thyroid, where's inflammatory markers, kidney, liver function, just kind of get a good panel of health, if you will, or lack of. But I often will have to follow that up with looking for toxins, looking for mold, looking for gut health, like with stool testing, heavy metals. So this family was like, just do it all, like on day one, like just do everything. I don't care how much it costs. Let's do it all. I said, okay, like, I don't even know, that may be way overkill. Like most of the time that's kind of way overkill, but they were like, no, we're done messing around. Let's do it all. And everything came back abnormal. And I'm not kidding. Everything. I couldn't even believe it. I was like, how is this kid not in the ICU? He had arsenic toxicity. He had a parasite. He had bad gut bacteria, like not just like, oh, you have some dysbiosis. No, like he had like nasty, get out of here, Clostridium kind of bad gut bacteria. He had strep. So that's sort of in the PANDAS world. And he had mold. He had mold toxicity too. I mean, literally every test I did, I was like, oh my gosh. Okay, so now I have to go to this family and say, your kid has everything's wrong with them. I don't know, like, that couldn't possibly have all happened in one day, but something tipped him over, like as he was getting this toxic burden, so that summer he just changed. And so of course they're like, okay, cool, let's detox, let's put him in the hospital and let's detox him and we'll fix all of it, in a month. And I was like, yeah, that, unfortunately not how it works. So we come up with a plan. Let's treat the strep. Let's start treating the mold. They had to clean out their house. They cleaned their house. We start treating the mold. Got to treat the arsenic, get rid of the heavy metals. Let's start working on the gut. And we just did things very piece by piece, because if we do everything all at once, especially in a 6-year-old, we're going to have Herxheimer reactions, which is a really negative detox reaction. I mean, we've got to take it step by step. And that's where he's such a great shining example of how amazing things can improve if you take it step by step and have that patience. But anyways, I'm getting ahead of myself. Obviously the story ends well. And so we went piece by piece, lots of ups and downs, moments where it was like, oh my gosh, we're getting rid of mold. You can clearly see he's calmer. You can clearly see he's more self-regulated. We get rid of arsenic. We clearly see the OCD and anxiety start to go away. I mean, all of this stuff was really, really fun to watch, but very time consuming and slow. You can't get rid of arsenic overnight. And so really went step by step through everything. And we had to take his tonsils out because that dang strep didn't want to go away. So we took his tonsils out, and we even had to go to IVIG. So, I mean, he literally had everything, and we literally did everything to get this kiddo better. And it took a little over a year, but oh my God, I mean, he's completely back to baseline. I mean, he's off, no more anti-anxiety medicine, no more ADHD medicine, back in school, not summertime, but he will be, and doing amazing. And so I just love that story where you have basically the sickest kid, in my opinion, that you can have, and you just take a year, take 18 months, slowly start to tick off the boxes and get somebody healthier. And they're back to where they were. And it's so cool, because otherwise what would have happened? This kid would have been on Zoloft and Ritalin forever. And they always would have been like, well, it didn't really work that well, because if that would have worked amazingly well, they never would have found me, right? And so just is so cool to have basically kind of turned his life around. And now if he flares, we're gonna know what to look for. We're gonna hit it head on. He's not just gonna go back to see the psychiatrist. And I love my psychiatrists out there, but some of those medicines are great. And then sometimes we got to look for the root cause.
I think so. Can you comment about the mold, level of mold toxicity here in Houston for the kids? I mean,
Yeah. Yeah, so about 25% of the population as a general rule is going to be genetically at risk for chronic inflammation related to mold. So there's mold everywhere in Houston. Most homes, if you talk to AC people, they're like, yeah, every house has mold in it. Like, that's not a problem. So mold is everywhere. But the bigger issue is how are you going to react to it? So if you're in that 25% that can't, quote, detox or handle that toxic mold, you're going to hold on to it. Your body's going to overreact to it. And now you are in a chronic inflammatory state. And the medical term for mold toxicity is chronic inflammatory response syndrome, or SIRS. And so that's, yeah,
And-
it's very common in Houston, but you also have to have that genetic predisposition.
what symptomology would the parents look for?
Yeah, very non-specific. So headaches, stomach aches, fatigue. I've seen seizures. You can have anxiety, you can have mental health kind of symptoms. It depends too on the age. So I'll see more mental health stuff in younger kids versus in older kids or teens, adults. I might see more migraines, stomach issues, fatigue. So very, very non-specific, right? Like, oh, my stomach hurts. It's a really common complaint. Like, how do you know if that's from mold, or is that because you're, eating the wrong food?
Right. Excellent case. Do you have another one?
Yeah, well, I have easy ones.
Okay.
I think they're
What's an
easy.
easy one?
Like the typical kind of PANDAS. So PANDAS is pediatric autoimmune neuropsychiatric syndrome associated, or neuropsychiatric disorder associated with strep, PANDAS. And that is basically a chronic inflammatory response to strep. And so it's kind of straightforward because it's not arsenic and mold and all this stuff. And so typically then you'll get a kiddo who gets strep, and about 2 weeks later, they have this acute change with tics and OCD, maybe some restrictive eating. And so it's not always do they know that they had strep, but a lot of times they do, and kind of thought, no big deal. We got antibiotics. It should have been all good. And then 2 weeks later, maybe 4 weeks later, they have this acute change. And so that's a little bit easier because you really, the name of the game is get rid of the strep. And so we do antibiotics, we might do tonsils, to get rid of the strep burden. And then also we can follow that up with IVIG or some immune treatments if needed.
I remember that one case I sent to you about that little 6-year-old boy that was biting kids and everything like this. He was like a little rabid dog, and they were going to put him on antipsychotics. And I said, no, please, let's look at his brain first. And we looked at his brain. It was like, oh my, this is a case for Melissa, Dr. Jones here. And this is the one about the Roundup. Remember that one?
Yeah. Oh yeah. A lot of toxins in our environment, which is really scary and overwhelming. I mean, there's Roundup on maybe all of our food. I mean, even organic food now has been laced, unfortunately, with some Roundup that's floating from other fields. So yeah, I do test for toxins, and Roundup, which is glyphosate, that's a pesticide that is put over non-organic plant crops. And so, yeah, we will test for that. And then you have to do sweating. The only way to get Roundup out of your body is avoid it. That's number one. Try to eat organic and avoid the Roundup as much as possible. And then sweating. And then I do a supplement called NAC, which is glutathione. Basically, it helps to detox, but Roundup's tricky because you've got to avoid it.
I see these commercials. I see these commercials for Roundup. You just spray it in your backyard, and you'll get rid of the weeds. And then the kids walk around barefooted in the backyards, and the biggest pores in their bodies are in the soles of their feet. And some, like you said to me, some of these kids just can't chelate it out on their own.
Right. I know.
Okay.
Yeah, and if anyone else is interested in learning more about toxins and how to combat that, we did another discussions with Dr. Ron with another guest speaker about maybe 6 months ago, maybe, and it's up on our YouTube channel. Y'all could look for that one. So, Dr. Jones, you mentioned that symptoms that you can give parents to suggest that they should consider digging deeper. It's pretty much just like those non-specific symptoms you're mentioning, like nausea, headache, fatigue.
Yeah, anything chronic or anything like an acute change. So especially, I mean, I'm neurology, right? So I'm going to see a lot of neuropsych stuff. So if your kid wakes up one day and they're super anxious and they can't separate from you and they can't, and then they're, you know, they're not too like a normal separation anxiety, but like, you know, an 8-year-old who all of a sudden can't leave your side, and OCD, restrictive eating, tics are a huge one. If ever I see tics, I no longer think of it as this like dopamine disorder in the brain that I was trained. I'm like, nope, there's inflammation. Let's go hunting for it. So any kind of acute neuropsychiatric change, I really think about digging deeper. And then anything kind of chronic. Oh, I've had headaches, you know, chronic headaches for a long, you know, some people you get the flu when you get sick and you have headaches and they go away. All right, you don't need to come see me. But you know, if you've had chronic headaches, epilepsy, chronic abdominal pain, things like that, where you're going, I don't know why, I just always feel run down, tired, crummy. Then it's like, okay, hold on, what are you getting exposed to, or what might be going on? And, you know, obviously a lot of potential answers to that question, but that's really what I think would prompt you to maybe want to seek out a functional doctor.
Okay, thank you. That's very helpful. We have a comment here asking if a prescribing physician refuses to do testing for mold, arsenic, etc., what are the alternatives? Are there home tests that are reliable, or do these types of substances require blood work for detection?
Yeah, so there's a lot of companies that you can, as a parent or person, go online and order mold test, stool test. I mean, there's a lot of things out there that you don't necessarily need a doctor. I think the hard part, and probably you should have kind of a functional doctor somewhere in the background that you're ready to call, because what do you do with the results? Like, let's say it comes back and there's a lot of mold toxicity. Okay, great. You got to test your house. You got to get rid of the mold, but you may need a prescription gut binder to get that out. And that's where it's nice to have a physician on your side, whether it's a Western medicine or integrative physician that is ready to kind of prescribe that. Same thing, like with the heavy metals, you might need to do chelation, like to have somebody there that can help walk you through it. But the testing doesn't necessarily have to be through a doctor.
Okay, that's a good point. It's like if you do it from home, then what do you do with the aftermath, with the information that you get, and if you can even understand the information of the results?
Oh yeah, I mean, like stool testing comes back like 17 pages. It's all words that nobody understand. Like it's all these, bacteria. You're like, is that good? Is that bad? Like, I don't know. So yeah, it is overwhelming.
Yeah.
There's a very large functional medicine group here in Houston, and we're having meetups 4 times a year where we do presentations and stuff, and Dr. Jones belongs to it, and I belong to it. It's a great group of people. The problem with functional medicine is most insurances won't pay for functional medicine workup, or a lot of the labs that Dr. Jones orders, they won't pay for. So it can be expensive, but in the long run, trying to treat the symptoms with psychiatric medications is not going to work for years. And getting to the source of the problem, that's why it's the most rewarding work we do, is when we finally uncover it and say, here it is, this is what we're looking for. And that's what we would have done here for years with the EEGs, and they come back atypical, and it's like, okay, this puts us into a direction. This is no longer a psychiatric or psychological case or behavioral treatment case. It's got to go into neurology to dig deeper and figure out what's causing these sets of symptoms. What are the questions?
Okay, so the next question, we're curious, how do you feel neurology needs to change over the next 10 years?
Well, the good news is I definitely already see a shift and a change. So things like because I've been treating pandas since I first started out in 2011. So for me, I've been always sort of aware, or maybe more open-minded to some of these neuroinflammatory disorders. So a lot of people in Houston maybe weren't trained or don't know about it, but that's changing. So we're already seeing big PANDAS centers coming out around the country and neurologists getting trained in this. But more importantly, I can't go to a neurology conference anymore without them telling me something about the gut-brain axis and the gut-brain relationship. And, oh, they're doing this research on baby rats. And if the rat mom has a problem, then the rat babies have autism, and it's all about the gut, and probiotics helped. And I'm like, okay, cool. Like they're doing the research, they're trying to fit it into their Western medicine mold and figure it out, which is great, because then the next generation of neurologists is going to get that training. So I'm already seeing that shift, which is exciting. It's going gonna take time, but it is happening. But what I really feel like needs to shift is this mindset of psychiatry separate from neurology. It's the brain. And more evidence is coming out that depression has nothing to do with serotonin. And that these medications, these medications that are serotonin medications, that's not why they work, and or they really don't work that well. So that's really, I want to take away the stigma of psychiatry and make it more medical, because it is unbelievably rewarding when I have somebody with debilitating OCD who can't leave their house. I treat them for mold toxicity and they're completely functioning people. And it was like, that was medical. That's as medical as you get. That wasn't psychiatry, whatever, that wasn't psychological. That wasn't in their head, whatever that's supposed to mean, because the brain's in your head. But anyways, what do I know? So that's what I would really like to see change, is more psychiatry pulling into the neurology world and us working together and saying, hey, this is all medical. How do we help?
I think that's a fantastic way to look at it, because in the long run, these cases, it takes the guilt away from parents. It takes the guilt away from the kids. Now, people aren't guilty over having cancer, for instance. You're not guilty for that. I mean, that does cause a lot of other issues, but I think that's where I've seen the biggest thing is it's not your fault. It's not your parenting. It's not your, your genes. It's a medical condition that we need to be looking at. And this is, I think, we're just starting to open up this through the linking of psychiatry, neurology, and functional medicine. That the triad that we really need to keep all in our heads, that this is, we've got to get to those places where people can finally feel that there's answers for them. And a mother's gut is still the best diagnostic tool we have out there.
100%.
Yeah. Well, speaking on that with mother's guts, what advice would you give to parents regarding brain health of their children?
Yeah, so I would really, we live in a toxic time. I know every time period had their own toxins, but I feel like there's a cumulative effect going on here, where we've got microplastics in our blood. Now that's, blasting across every news channel. We've got Roundup, we've got heavy metals, we've got EMFs, there's so many toxins. And I think we need to think about what we're feeding our kids, what we're giving our kids, all of these things. And it's overwhelming. If the parents feel overwhelmed, yes, it's overwhelming. I'm a mom too. Like, oh my gosh. I'm like, okay, our house, we can't have gluten. We have to minimize dairy, and we have to have Tupperware that's glass because we can't do plastic. And it's a lot. But I think if we can make some of those changes, hopefully even as a country, stop all the why are we fast food nation? Like, no. If we can start feeding our kids healthy, non-fast food, organic food, go back to pre-1970 and, minimize the toxins. That, I think, is the best way we can support our kids' brain development.
Yeah, that's a very valid point. And then just starting somewhere, just starting with one small change, it can feel very overwhelming. And so it's like, you don't have to do all the things at once, just pick one thing. Focus on that. And then when that becomes like it's part of your lifestyle, start the next thing. And then before you know it, you'll have made several changes.
Agreed.
So Dr. Jones, we have a comment that asks if you see adults, and if not, is there anyone in the field that you would recommend who could see adults?
Yes, so I do. So I have two practices. I have a pediatric neurology practice in Katy, and then I have a functional neurology practice in the city off of I-10 in Chimney Rock. And so I can see, that is a cash practice, no insurance. So I am free to see kids or adults. And so I can see adults at my functional neurology practice.
That's great.
That's good. I had a question. You mentioned parasites earlier, and I don't know if this is like a fad or if it's just the side of TikTok I'm on, but where people what were they eating? Like papaya seeds. They were saying that flushes out parasites and all this parasite stuff. How often do you see people with parasites? And
yeah, more than you think.
Papaya seeds?
Yeah. I would thought, being in America, that we don't have a lot of parasites, but I was wrong. So we do see quite a few parasites, and that's a tough one, because there are some parasites that we potentially could transiently get exposed to, and our body might be able to work its way out. And so as we do stool testing, you know, it's a snapshot in time. So that's always a little bit hard to know, like, okay, well, is that really the root of the problem? Or did we just happen to catch a parasite that you know, drank and you would have gotten rid of it on your own, especially in people that don't have any GI symptoms or, you know, bloating or diarrhea or whatnot. But I have definitely seen my fair share of some nasty parasites where I'm like, oh no, this is not just a passing by night parasite. We gotta get rid of that one. And they feel so much better. So yeah, so there's parasites than you'd think. I do stool testing that is pretty comprehensive to try to get a handle on the good, the bad bacteria, the microbiome and the parasites. Your traditional tests like LabCorp or Quest, even if you talk to GI doctors, they're kind of like, yeah, those aren't super reliable. So I tend not to do the traditional parasite testing, but I'll do more functional comprehensive stool testing.
Mary Tracy had a question there. Do you see that one?
Yeah, it looks like it's for you.
Mary Tracy wants to know, did you do on the EEG on the 6-year-old that Dr. Jones presented at the beginning? I did it on the one with the roundup. We just lost. Oh, there you are. Yes, I did the one on the roundup, but I didn't do the one, I think, of the first 6-year-old she was talking about. And what's it say here? Can you expect to see anything else in the brain of a child plagued with so many inflammatory problems other than diffuse encephalopathy? Mary, this is something that I'm really struggling with right now, because diffuse encephalopathy is an easy identification from the 2 neurologists I work with that do all my reports for me, do my 2 reports for me. And that's easy. But I think encephalopathy, and Melissa, please chime in on this. Encephalopathy is like on a continuum. It's on so from not so severe as the brain starts to be lower and lower voltage, lower amplitude coming out of the that we can read on the EEG, and then it slows down. So I think I've seen these ones, EEGs, and I'm sure you have, Melissa, that they don't really meet criteria for diffuse encephalopathy, but there's just something not right with these EEGs. And I don't think there's a category for that's just not right. It doesn't pass my funny look test. I'm sending you one just like that this week. So it just doesn't pass my funny look test, and the symptoms match something in the body going wrong.
Yeah, it's true. We really don't have the words yet for the EEGs of these kids. I mean, I'll often just say it's a dysrhythmia. There's something wrong. It's not in the right rhythm, but I can't really tell you more specific than that. And no, so Dr. Ron did not see that particular 6-year-old I was talking about, but I did a regular EEG in the office, and he did have isolated epileptiform discharges at the beginning, and those went away as we treated him.
Excellent.
Yeah.
Excellent.
I had another question for you. What was the additional training that you went through to make this shift from pediatric neurology to the integrative pediatric neurology?
Yeah, lots. So my journey kind of started back in about 6 years ago when I learned for the first time about toxic mold. We were trained as medical doctors that mold is only a problem if you have cancer and you're immunocompromised. And then I had a patient that got treated by a functional doctor for toxic mold and got she had migraines and they completely went away. And I was like, hold on, that's my job. You're stepping on my turf. And so I reached out to that functional doctor, and she was amazing, such a mentor, and helped me get into some webinars and conferences on mold. And that just opened my world. And so that just led me to more conferences and meeting more people. And then that's where I met Dr. Greenblatt, who does the Functional Integrative Psychiatry Fellowship. And so I thought, okay, this is where I need to be, really get a good foundation in functional medicine. And it's a 2-year course, and it's in all things neuropsychiatry. So that's what I did, and I completed that in 2023. So
yeah. Excellent. I know there's a lot of training to that, and I was looking, how can we get more and more? And just but thankfully I've got you to be able to refer to and these functional medicine docs to refer to. And now they're starting to refer me strange cases because if they can't figure it out, it's got to be in the brain, right? So I'm glad to know that you're setting up to do the adults in your Alpha I-10 office there. I think that's fantastic because prepare to get even busier.
Are you doing any other open houses anytime soon? I missed your last one.
Oh, yeah. No, we've been pretty busy, so we haven't
Okay.
really had the chance to do another open house.
Nice. Well, that's good.
Yeah.
Now, if you can, if at some point in time can put in your information about your locations and that would be good contact information and everything because
In the chat.
it's so hard to find docs that that dig as deep as you do, that care as much as you do. Everybody I send comes back and just raves over your manner and everything. You truly you're the oddest neurologist I've ever met next to Rusty. That doesn't fit the mold of most neurologists that we know out there. So I think it's phenomenal. It's been a pleasure working with you over the years.
Thank you.
Oh,
And I see a question. Do I see clients out of state? So I have a Texas license. So anyone I see has to come to Houston for their first visit to establish and do an examination and everything. But then as long as I'm not prescribing any medications, like if it's just going over tests and coming up with a plan, and maybe there's another doctor in that state that can work with me, which I do all the time, then yes, I can see people out of state, but that first visit needs to be in Houston.
Got you. Got another question down there from Julie.
Hypomania. Oh yeah. Okay. So sort of like a bipolar kind of situation. I think, yeah, anything psychiatry, I am going to start to dig deeper into, is there any toxins, any infections, any inflammation?
Fantastic. It's what we need out there. There was a report that came out in 2022 from the World Psychiatric Association, and they said that over the past 50 years, when they did a meta-analysis of all the meta-analysis, that this medication interventions and psychotherapy don't seem to be efficacious. And I think you hit the nail on the head when you were talking about that you can't treat a psychological problem caused by physiological issues with the psychiatric medication. And psychiatrists get all these cases and get them first. And then they try and go through trial and error period because they're working totally off of symptoms for their prescribing and not ever looking at the brain, not ever looking at the body of what can be causing it. And this is where I think people need to see the shift in the future for psychiatry and neurology is truly, we got to get to the source of what's going on, because if we don't, it's a never-ending battle of, but I tell you who hates it the most is the big pharma, because they would sell a lot less medications if they went to get fixed, for instance, from you.
Yes. Yeah.
Any other questions out there, guys? Got this. Okay, so let me see. What about you, Dr. Jones? Any other thought that you would like to throw out there that, because there's rarely that many people I know that even come in contact with a pediatric neurologist. I mean, you guys are kind of rare.
Yes. Yeah. Well, I think that like the word is getting out there. When I talk to my pediatrician friends, they're definitely a lot more open to what I do than, they would have been maybe 10 years ago. And like, if I start to talk about pandas, they no longer think I have lobsters coming out of my head. So that is good, but they're really our front line. So I think we really need to be training our pediatricians that if there's an acute change, we need to start digging a little deeper, and it's happening. I mean, they're referring to me and they're thinking about it, which is really great. Or they're checking blood work for strep and taking it more seriously than, oh, you just have an anxious 6-year-old. It happens. So I think, we really need to educate that front line and the pediatricians, and again, psychiatrists too. I'm baffled with how many psychiatrists don't even check thyroid levels, and I'm going, wasn't that kind of Psych 101 to check for B12 and check for thyroid? And And it just seems like it goes out the window the longer they're in practice. They just say, okay, here's everybody, here's your Zoloft, which again, I'm not anti-Zoloft, but there's a place for it. You just got to rule out the medical stuff first.
Well, I had a quick question because you're talking about PANS, PANDAS, and strep. I'm not familiar with the correlation. Are you saying that anyone who has PANS and PANDAS always gets strep or vice versa? I'm not aware.
Yeah, so there's PANS, so that's pediatric autoimmune neuropsychiatric syndrome, which is, and eventually we're all going to call it autoimmune encephalitis. That's coming out in the next revision of terminology. That's what PANS and PANDAS is going to go away, and we're just going to call it autoimmune encephalitis. But for now, there's PANS. That's the big umbrella term, and that can be caused by any living organism. So long haul COVID could be under that umbrella. PANDAS, which is just the strep, can be under that umbrella. Mold can be under that umbrella. So lots of things like living organisms that are going to cause an acute neuropsychiatric change. So we kind of use them interchangeably in the PANS PANDAS circles, because and oftentimes if you just look for strep and you find strep, okay, that's great. That's something you need to treat. But a lot of times those kids have some kind of immune dysregulation. There's something going on there where they just are not fighting it correctly. And so their immune system almost gets on hyperdrive, and they're making these antibodies that are just completely unnecessary. And so that could be to a lot of different things. So that's, again, where you start to go hunting and you're like, oh, you actually have all these viruses and parasites and all these infections. And so we just got to clean up the body and get the immune system back where it needs to be.
Okay, thank you for that.
I have a question.
Hey, Mary.
Yeah, I had a really bizarre case a couple weeks ago of a 15-year-old male who had been diagnosed with a number of things from about age 6, including ASD. And he was on methylphenidate and guanfacine. His mom took him off of those medications. I told her not to do that. Like, I cannot recommend that you do that. About 3 days before I did the Q on him. And he had the classic fast, slow phenotype across the frontal strip. A lot of theta and a lot of beta with not much alpha. And those are the two medications that would normally be prescribed in order to try to control an attention deficit disorder, anything that would involve that fast, slow phenotype. Well, what happened was it took me about a week to get the report done, and we did a Zoom meeting. And this kid who couldn't make eye contact with me, who would not answer any of my questions, was on the Zoom meeting, and he's like, "Hello, Dr. Tracy." I'm like, "Hi, how are you doing?" "I'm doing great." His parents said he's been on these medications for 6 years. Since they took him off, he is like a normal human being.
Whoa.
We had a complete conversation face to face on Zoom. And it blew me away because I couldn't really communicate. At one point, when I was putting the cap on him, I said, "Hey, I think we're going to become good friends." And he goes, "Oh, I'm not so sure about that." That was the only communication we had, right? So my question is, first of all, how do you work with prescribing psychiatrists who are already on board when somebody comes to you? Because that's almost always the case with me, just as a person who does QEEG analysis and makes recommendations. Do you have to, I assume you have to deal with a psychiatrist in order to become the prescribing physician?
Yeah, so I always say I work well with others. So I do, and I know a lot. I've been here my whole life, literally. So I trained with a lot of the doctors that, you know, are in the community, and gotten to know the ones that I didn't train with. So usually they're pretty open to me saying, "Hey, I found XYZ. I'm going to treat that. Are you okay with me tweaking or adjusting or, you know, whatever with the medication?" And for the most part, even though psychiatrists don't necessarily do this testing or understand it, they're usually pretty open to it. The docs that aren't open to it are my fellow neurologists. They're the ones that are like, "No, that's crazy. You should just do Lamictal," which I love Lamictal, but so they're the ones that are a little bit more of a brick wall. The psychiatrists are usually reasonably open-minded, but yes, I do have to reach out to them and kind of say, "Okay, hey, hi, I'm jumping in, and this is what I want to do." And usually they're pretty open to working with me.
I think you've got the street cred and they recognize that. You know, we're not MDs and we have a much more difficult time getting their attention. When I do find a psychiatrist who's willing to look at the data and to have a conversation with me and to try something, it's like 1 out of 10, you know? And I mean, I didn't just fall off the watermelon truck, you know, I'm not somebody who's just, you know, I've got a BA and I'm doing Qs and I'm, you know, making ridiculous claims about what's wrong with this kid's brain. I've been doing this for a long time. And I think I have a pretty good reputation, but man, it's really hard to get traction. I don't know if you have any recommendations for that.
Oh, I mean, yeah, that's hard as, you know, a non-MD. I think, like you said, you kind of have to just have your work show for itself. And so, you know, as you have more and more patients that are improving and just kind of have that in your back pocket to share with them when you're trying to talk to them, that is really hard. And I mean, I have had docs that literally just never called me back. I'm like, all right, I can't force you to work with me. I can't force you to call me back or listen to me. I mean, that happens. So yeah, that is tough.
Okay, I appreciate it. Go ahead, Ron.
That's one of the reasons that I use Dr. Turner and Dr. Bengro, because then I can hold their reports up to a psychiatrist and I could say, it's these 2 neurologists that I work with. This is what they're saying. They're recommending MRI. They're recommending further testing. They're recommending something. And it, you know, I have to have their backing because it's just so hard to get the door open. Then once the door's open and they know they're attached and everything else, then they'll listen. But I had one more thing, since Pam's here and she has so many ADHD people that are members of her group association. I think that you're seeing, with all that you've done, attention issues, impulsivity issues, stemming from not your traditional, what you think of ADHD that will respond to a stimulant, but something going wrong in their body. What would you say off your cuff would be the percentage of people that of the children and adolescents that have ADHD, that it may be something other than, you know, something that will respond to a stimulant? What would you say to that? I mean, because there's a lot of people out there suffering with ADHD, and how do you develop it in adulthood? Well, you can get a head injury and still be classified as ADHD. Yes, we know that, but what do you think?
Yes, I really look at the family history. So if I have 2 parents or multiple people in the family and they're all ADHD, to a certain degree, you may have come by this naturally. And so, you know, those may be the kiddos that are really going to respond well to the medications, and that's the appropriate treatment. Doesn't mean I still don't want to do testing, because you never know. And I find a lot of deficiencies in these kids. Minerals and vitamins are huge. So I do test anyone who walks in with autism or ADHD. I'm gonna open the door and do some testing. But if there's a pretty big family history, I have found that even when I get them as healthy as possible, they still need their Ritalin. They're still going to benefit from that. So there is a genetic component there to some of these kids that, given our, you know, there's no maybe quote cure to every, there really are some people that have neuropsychiatric conditions in the more traditional sense that need your traditional medications, and that's fine.
Fantastic. I agree. Are there any, one question here about supplements that you think everyone should be on due to the toxic load we're all living under?
Yeah, so I put a little response. Oh, but you know what? I think I just sent that back to one person. Oh, how do I change that?
Private response.
Okay, hold on. I don't know how to change that. That was my bad. I sent that just to one person. Let's see if I can do that. There. Can y'all see that? Maybe. But anyways,
Yes.
I like fish oil. I like NAC or some form of glutathione. And then I like turmeric. So those are, to me, are sort of like foundational. I tell almost everyone that comes in my office, like, we're going to need these. But then I might tweak and add based on whatever the testing shows. And then we have to detox. So sweating, sauna. We live in Houston, so sweating's not too big a problem, but saunas and detoxing through sweat is also really effective.
And
There any
NAC dosages, yeah. So I always start at 600 twice a day, but you really can go up much higher if it's an adult. And then with the kiddos, NAC doesn't taste very good if you open the capsule and mix it with something. So they have some gel forms, liquid forms, other forms of glutathione. We're still learning. So my understanding is glutathione is reasonably hard to absorb in the gut. And so there's even like topical, there's a glutaril spray, there's topical glutathione that all ages could use. So anyways, there's a lot of different forms of glutathione out there, but usually for NAC, I'll start at 600 twice a day and kind of work up from there.
yeah, what about the Jeff Lewis asked, do you have anybody like yourself in Kansas City that you know of?
I don't know anybody in Kansas City.
Except for Dorothy and Toto.
Yes.
All right. Well, this is fantastic. We really enjoyed this discussion because that's the reason I wanted to invite you on, because this is something that nobody or hardly anybody gets an opportunity to go down the path that you've gone down in regard to trying to getting somebody better. And I do want to thank you for all your years of efforts. And I think anybody that sees this video can pass it on and say, there are answers out there, but you just got to find a doc that's curious enough to become a true physician, in my opinion, to try to heal a person, not just try to treat their symptoms. And that makes all the difference in the world. We've enjoyed our relationship with you for years. And I know that, when I send you a case, there's something there. It's not an easy case. But it's
that is true. And hold on, I am gonna put all my contact info in here.
Okay.
Yeah, everyone take a picture of her information because we'll have to hop off in about 3 minutes. We don't want you to miss out on it. And look, can we need
Oh, and somebody asked about can strep cause anger? Yes. Absolutely. And mood changes, rages, OCD, anxiety, tics, eating restriction, definitely, I'll think strep, but also Bartonella. That's another infection that I'll see a lot of rages with. So if somebody comes in with those symptoms, I'll start to look for other infections too, like Bartonella, and there's more.
Yeah, I know it. And when we started working years ago with the isolated epileptiform discharges that won't be seizures, but the kids often have these rage events, and sometimes they don't even remember them. They can get so angry. And those are the cases, I think, that have proved that. I always wondered what's causing those isolated epileptiform discharges.
Yeah.
That's where I think we need to take that next step now, is not just treat it with a Lamictal, but go that next step. And there's something irritating this person's brain enough to have it misfire. And we know sleep deprivation, hypoglycemia, and hyperstimulation can cause this activity to increase. So I don't know. I think that's the next step that we need to go, is to take it even deeper when we find these things, instead of just looking at stopping the seizure activity or the isolated epileptiform activity, but going after what could be causing that. So maybe that's a study you and I can do one of these days.
Let's do it.
Let's do it. All right. Sounds great.
Well, thank you everyone for attending. We are going to be putting this recording on our Houston Neuroscience Brain Center YouTube channel. It's usually up in about 24 to 48 hours, and you can find it there and share it with anyone who you think might be interested. Keep an eye out in your email for future emails announcing our next topic and date. And have a great week, everyone. Hopefully all of y'all have power here in Houston.
Thank you. Very, very interesting.
Bye, guys.
Thank you. This was great. Brilliant. Thank you.
Thank you so much. Appreciate it, everybody.
Thanks.
All right, Melissa, that was fantastic. You did great.
Thank you. That was fun.
Yeah, that was
So
amazing.
You've been hiding in the circle, hiding in the dark rooms all this time. Now we're going to bring you out. Become
I
famous.
don't know. I don't feel like I'm hiding. I'm pretty busy.
He doesn't feel that way.
Okay. All right. Well, again, I've got this one coming to you guys, and just enjoy that. I've already sent the the studies over to, and I hope the father calls.
Okay.
This is a tough case. All right. Thanks a lot.
Awesome. Bye, guys. See you later.
Bye-bye.
Leave your computer open, so when I'm kind of back to back.